Welcome to the Healthcare Uncomplicated YouTube channel. If you are here for the first time, make sure you subscribe to the channel. Also check all the previous content. Also check our partners involved in the channel. And today I have a very exciting guest for you. We have Joy Rios. She's the founder, CEO, and host of Hit Like a Girl podcast. Also, she is the HIMSS 2023 Changemaker in Health Award recipient. Joy, how are you?
I'm doing great. Thank you so much for having me. It's great to be here.
It's nice to see you again. Before the recording, we're talking about IMS and the traveling and our activities. So thank you so much for accepting my invite.
Anytime, João.
So today the topic is women in healthcare and health IT. And Joy, the first question that I have for you is, why do you think are less women in health IT than men?
Well, I think that there are not necessarily fewer women in health care than there are men. There's definitely women all throughout the system that are working hard. In fact, a lot of the workforce, I think, especially in healthcare system, are women. But when it comes to the tech side and also on the executive level side, there's a little bit of an imbalance. And I think that that's for a number of reasons. I think that partly that comes from building on systems of the past. For decades we have, and I think it's fair to say we've built in a male-dominated world and a male-dominated system from on the corporate side of things, and so women have had their challenges in getting involved at the executive level and on the tech side. So there's certainly barriers when it comes to gaining access, education, and also workforce development on that executive level side. We just have a different set of circumstances, and also considering the work that women are typically doing outside of a work setting doesn't necessarily get compensated for, but still is work that needs to get done. So it's complicated, I'd say.
Yeah, very good points there. This leads very nicely, Joy, to the next question, which is what are the main barriers for women to enter the healthcare or the health IT industry?
Well, I think on the one is like considering STEM, so the sciences and technology, engineering, etc. There's a lot of barriers there's a lot of encouragement in trying to get more young people, young girls and young adults into that area. But I think that there's certainly a lot of programs that focus on getting them in there. I think it's not difficult to get them into the education. It's hard to get them to stay. And so that is something that we have to consider, because it's a cultural barrier that comes from internally and also systemically. And I think that, as we need to be more diverse, equitable, and inclusive, there's definitely a sense of belonging that I think is oftentimes missing. Even if there are women at the table, if they're oftentimes the only or one of very few. And I think it's hard to pursue a path if you don't really truly feel or are helped to made feel like you belong there. And so ultimately, I feel like that is something that we all could do better on, which is, better in amplifying the women who work in STEM and in tech, also making sure that we're celebrating and acknowledging the accomplishments that they achieve, as well as their contributions, and helping to define more paths to leadership, and making sure that not only that there's just a space for them, but there's a future for them, and that they're part of the big picture, and considering not just where we are, but where do we want to go.
Brilliant. Thank you, Joy. Certainly, I feel from my side that actually things are much more equitable now, but also you raise really good points about staying there for the long run, if you like, and also leadership positions. We're seeing more, even with the conferences, the global conference that we attend, me and you, we're seeing more women on stage, more leadership. But of course, it's still a gap. And what you mentioned is very important. How can we keep people there that the work is recognized and they feel is a true career path? So thank you so much for raising these points.
Yeah, it's interesting. I sometimes forget because a lot of my work has focused on, and my energy is focused on amplifying the women that work in our field. And so when we go to these big conferences, oftentimes I look around and be like, oh yeah, I forget how many men there are here that are essentially, driving a lot of the conversations and part of the reason why I do the work that I do. So I appreciate being part of the conversation, at least where can we be headed and what can we do better?
Brilliant. Thank you, Joy. Moving on, you are known as taking bold actions and inspiring others. Can you expand a bit on this, please?
Yeah, I think part of that, I'm the founder and the host of the Hit Like a Girl podcast. That basically came from nothing. It came from me not having a background in podcasting or tech. I have a background I have an MBA and an English degree and plenty of healthcare certifications, but certainly not in podcasting. And it came from a place of just feeling like there was missing voices and missing conversations, and I wasn't seeing it happening. And so basically took it upon myself to create a platform, even not knowing what I was doing or what it would actually look like in the long run. So I think that there's something to be said for not letting your fear take over and doing something anyway when you see that there's something that needs to be done, even if it's a small step in the right direction. Those small steps add up to much larger strides. And I'm now 5 years down the podcasting road, and thankfully have been able to amplify more than 300 women in our field. And so, and it started from just doing one, asking my business partner and colleague if she'd be willing to have me interview her. Other things that I've done that have been bold has, during the time of the pandemic, taking an opportunity to travel across the country. I had the chance to visit 32 states and organize hikes with women in healthcare and technology to basically walk and talk about what they were experiencing during COVID, how they were handling and managing all of the different expectations that they had from them. And that was something that really catapulted the community aspect of the Hit Like a Girl pod. And so I would say that those are two examples. And I'm going to be doing that again. Actually, in a few months, I will be taking the podcast on the road for a second tour to basically highlight women around the country. So those are some examples of some bold actions I've taken.
That's brilliant. I really like that, starting something from scratch. Also, you are doing something right. I saw you in US. We're talking about Chicago before the recording, and you are recognized by your community, and you've done something right because you received the Changemaker in Health award. Is brilliant because this is really good. We need like more people like you that have that courage, that drive, but also take a risk, and then the others can follow and feel part of. Is extremely, extremely important. So really well done.
Thank you so much. I really appreciate it. And to be honest, it seems like the more the action that I take, the more I find that the community rallies behind me, and I don't necessarily feel like I'm doing it on my own. We get to do it together. That's ultimately, I think that's the point. It's like together, I think we can make the change we want to see.
Brilliant. Joy, we come to the end of the interview, but I have one last question for you, which I ask all the guests now, which is how can we make healthcare less complicated?
That's the $1 million question. That's the $1 billion question. I wish I had one answer to that. I think that it comes from whole systems thinking and really understanding that every part of our system is connected to every other. And so knowing that whatever change you're making is affecting folks, technologies, systems all over the country and world. And so I would say, even though I don't know the answer to your question, I think that making consistent efforts in that direction, and working, coordinating and collaborating with as many folks as possible. If we could come from a government, corporate, and community-based place, I think that we would get a lot farther faster.
Brilliant. Fantastic way to end. Joy, thank you for accepting my invite again. Also, congratulations on your work on Changemaker in Health Award, recognized by HIMSS, uh, in this case 2023. But yeah, it's brilliant what you're doing in the industry, and thank you so much for accepting my invite.
It is my pleasure. I really, really appreciate your time. Thank you.
Brilliant. I'm gonna wrap up now. To all our viewers and listeners, make sure you subscribe to the channel. Also follow Joy's work. I'm gonna post here social media, Twitter, website. Follow Hit Like a Girl podcast, and I'll see you all next week.